Ladies, you are the backbone of healthcare. You schedule the visits, ask the hard questions, and you show up, often for everyone else first. Today, I'm showing up for you. We're going to talk about women, cycles, and the carnivore diet, or very low-carb way of eating. What's normal, what's not, and how to work with your biology so your plan serves you, not the other way around. Here's the headline: but the body of a woman doesn't work like the body of a man. And I must admit, that's a headline that rings true. For women, hormones shift across the month in ways that change insulin sensitivity, appetite, water and mineral balance, even resting metabolism. If you try to eat or train exactly the same every day, you'll think you failed. You didn't. Your plan ignored your design. Let's zoom out to the menstrual cycle. In the follicular phase, that's your period through ovulation, most women are a bit more insulin sensitive. After ovulation, in the luteal phase, progesterone rises and many women become a touch more insulin resistant. Translation: the same meal can hit differently across the month. That's physiology, not willpower. Quick fact: in the luteal phase, average daily energy intake tends to rise. Think 150 to 300 extra calories for many women. And resting metabolic rate ticks up a bit for some. If you feel hungrier the week before your period, your body isn't broken. It's preparing. Plan for it. Another quiet hormone player is leptin, your I'm fed signal from body fat. Leptin commonly runs a little higher in the luteal phase, while appetite hormones like ghrelin can wiggle too. This helps explain pre-period hunger waves and cravings, even on carnivore. Knowing that reduces guilt and helps you plan the plate. Now, what happens when women go very low carb or carnivore? First, the electrolyte story. Insulin normally helps your kidneys retain sodium. Drop insulin with low carb and you urinate out more salt and water. In fact, that keto flu that happens in some is often due to low sodium. Add the cycle on top of that, estrogen and progesterone also influence the renin-angiotensin-aldosterone system that manages fluid. In the luteal phase, many women retain water, feel puffy, then lose it as the period starts. On low carb, that swing can be exaggerated if sodium and minerals are too low. Solution: add salt like you mean it, as opposed to thinking about it as an afterthought. Second, the thyroid story. Low carb and ketogenic diets often lower T3 modestly without raising TSH. An adaptive shift, not necessarily thyroid failure. Most feel fine or better. But if you have thyroid disease or symptoms of hypothyroidism, test and individualize. Don't white knuckle it. Third, PCOS and carnivore. PCOS is one of the most common hormone problems in women. And for many, it's driven by insulin resistance. When insulin stays high, it tells the ovaries to make more male-type hormones, which can disrupt cycles and ovulation. By lowering carbs and lowering insulin, you often see the ovaries settle down. That can mean easier weight loss, more regular periods, and in many cases, better chances of ovulation and even pregnancy. It doesn't work for everyone, but both research and my own experience shows that when insulin improves, the ovaries usually follow. If you're trying to conceive, just be sure you do it with guidance from a healthcare team. So, what's normal when women start carnivore or very low carb? A few months of wobbly cycles as weight, leptin, and insulin shift. Periods are a bit early or late, changes in flow, PMS shifting. There may be a size fluctuation from water changes, especially late luteal. More noticeable when carbs are very low. Hunger surges in late luteal. Plan for these changes. Don't fight them. Now let's touch on what's not normal and deserves a check-in. No period for 3 months after previously regular cycles, or 6 months if previously irregular. That's secondary amenorrhea, and something you need to evaluate with your clinician. Start with a pregnancy test. Then look at thyroid, prolactin, energy availability, and stress. Persistent cycles greater than 35 days, also called oligomenorrhea, after the initial adaptation window, especially with acne, hair growth, or weight gain. Think PCOS workup. Let's say you're postpartum or breastfeeding and feeling unwell on strict keto. Nausea, rapid breathing, weakness. Rare but real. Lactation ketoacidosis has been reported. Do not push deep ketosis while nursing without medical guidance. Let's get practical. Here's a Carnivore Smart Carnivore playbook you can start using tonight. Let's start with the follicular phase from your period to ovulation. You're typically a bit more insulin sensitive. Many women feel lighter and train better. Priorities: nail protein, don't undereat, and keep electrolytes steady. If you like leaner cuts, this is where they often feel great. Keep sleep and stress dialed in. Those two sabotage hormones faster than bread ever could. Let's go to the luteal-phase, that's post-ovulation to your period. Expect higher appetite and a small bump in metabolic burn. Strategize, don't apologize. Add 100 to 300 daily calories of intentional fat, protein from egg yolks, salmon, ribeye fat trimmings, tallow or butter on your steak. Increase sodium carefully. Common low-carb target is 3 to 5 grams of sodium a day total for a healthy adult. Personalize if you have hypertension, kidney, or heart disease. Many women feel best adding approximately 1 extra gram in late luteal via salted broth or salting meals. Consider magnesium glycinate 200 to 400 milligrams at night for cramps and sleep. Clear it with your clinician if you have kidney disease. Expect the scale to lie. Much of the pre-period gain is water. It disappears like that first coffee on Monday. And check out my video about the lies that the scale tells you. I'll share it on the end screen at the end of this video. Here are some lesser known high leverage tips. Number 1, if heavy periods leave you drained, check ferritin and iron indices. Carnivore gives you highly bioavailable heme iron, but heavy bleeding can still outpace intake. Replace iron as needed. Watch energy and hair. Number 2, women with a history of low energy availability, chronic dieting, high training loads, are at risk for functional hypothalamic amenorrhea. The fix isn't more carbs. It's enough total energy, stress relief, and a physiology-friendly plan. Number 3, perimenopause magnifies insulin resistance for many. Low carb can be a powerful lever, but sleep, strength training, and protein are your big 3. Metabolic changes across the menopause transition are documented. Your hunger, mood, and belly fat aren't a moral failure. They're biology. Frequently asked questions. Should I carb cycle around my period? Evidence is mixed. We do not see higher energy intake and a small rise in resting metabolic rate late luteal. And some women notice deeper ketosis feels harder that week. You can experiment with a modest bump in total calories from animal fats and or a small strategic addition of low glycemic carbs if you tolerate them, like a bit more dairy if you tolerate it, or a measured portion of lower sugar produce if you're not strict carnivore. But the bigger win is meeting your energy and mineral needs and sleeping like it's your job. Now let's look at a red flag checklist and when it's time to call your clinician. 3 months without a period, or 6 if you've always been irregular, bleeding that soaks through a pad or tampon every hour for several hours, or periods lasting greater than 8 days. New severe pelvic pain, postmenopausal bleeding, or signs of anemia like extreme fatigue, dizziness, pale skin. Let's say you're pregnant or breastfeeding and feel unwell on strict low carb. Especially with nausea, rapid breathing, or confusion, consider lactation ketoacidosis. My bottom line from a root cause lens. For many women, lower carb eating reduces the insulin chaos that drives cravings, PMS swings, and PCOS symptoms. But the plan must respect the natural monthly rhythm. Eat enough, salt enough, sleep enough, train smart. And remember, if your cycle sends you a message, it's not nagging, it's brilliant biofeedback. All right, ladies, I hope this video was helpful. Hit like so more women see it. Drop a comment telling me where you're watching from, and share your best luteal-phase survival tip. And if you want more women-specific metabolic content, make sure you're subscribed. Your future self will thank you. I'll see you in the next video.